And welcome back to the morning show. Here we are with Dr. Brooks and Mohave Skin and Cancer. This is Bullhead City office. We thought we better bring you over here to let you know that there are two locations, at least in our area. Good morning.
Nice to see you again.
Good seeing you,
Welcome,
sir.
welcome.
It has been a while. How have you been?
I've been good.
Yeah, I understand they're working you to death over here.
No. As you noticed, our waiting rooms, we take the patients that we want to take so we don't get overcrowded. But yeah, I'm as busy as I want to be.
Yeah?
I'll put it that way.
Well,
yeah.
we shouldn't be doing this then.
Oh, no, you're good.
Because we're going to make you a lot busier, I tell you. And the doctor's been coming. You've been up here for about a year now, haven't you?
In this location, almost 2.5, and here
Good
total,
grief.
almost 4, yeah.
Oh, for crying out loud.
Yeah.
Very nice facility.
Yeah, it is. It's pretty.
You know, we're getting into the summer months.
Yes, sir.
Yeah, duh, you know that, but neither. What do people need to be watching out for right now before they start getting out in the sun?
Well, first of all, people that take long motorcycle rides need to be extra careful. I had to throw that in there. He just is making me jealous about the plans he's got coming.
Yeah.
So when you're out and exposed, all of us, no matter what your age, you got to be careful. The sunshine does damage to your skin. The more sunshine, the more damage. So should you go out and play? Absolutely you should. But when you do, sunscreens. Clothing is the most beneficial, but most of us don't like that.
Right.
So after clothing, you've got to do topical sunscreens. Most people say that below 30 SPF, you're not doing a whole lot of good, maybe augmenting a tan. And above 30, you're starting to do some real good. And above 50, a lot of the efficacy starts to wane again. So somewhere between 30 and 50 is kind of that sweet spot.
That's what you'd recommend.
Yeah, at least. And then go play. I mean, a lot of people say, gosh, I should never go in the sun. It causes cancer. Excessive exposure and sunburns and all of that, that's true. But we live in a gorgeous part of the desert. The river's right next door. I mean, we've got to go play, but we've also got to be smart about it. So, I want to make sure that's clear because I play too, but I also cover up when I go.
And herein lies the problem. I mean, young guys and gals both, especially gals, they don't wear those really thin bathing suits or skimpy bathing suits.
Yep.
For anything, well, they may, but for anything, generally speaking, to get a tan.
Correct.
A lot of tan.
That's right.
So you aren't going to get a tan with 30 to 50 on, Doc. What do you recommend?
You'll get a little bit of a tan with 30 on, and you do need some sunshine for health. So you do need some vitamin D. Sunshine is good for you in small amounts, but too much sunshine, we're just not built for it. Or your
Right.
skin's just not designed for it. A lot of the other animals that roam around, and reptiles and fish, they're designed for it. They do beautifully. But humans, we have to consider ourselves part of the animal kingdom, and our skin isn't. It's just not built for it.
Is there a happy medium? I mean, can somebody, get up in the morning, we're going to the lake, okay, from 11 to 12, I'm going to be out in the sun, then the rest of the day I'm going to go ahead and put on sunscreen. I mean, is that...
If you're going out all day, I would recommend protecting yourself all day, because if you're in and out of the water and in and out from under the bimini top and you're playing hard, I would just say sunscreen. That being said, if you don't go out much at all and you want to go out for 5 or 10 minutes without anything on, just to get a little color, a little bronze, that's fine. But anytime you're out all day, I'd cover up for sure. One of my favorite sunscreens are clothes from Savers or from Salvation Army. Just a cheap white shirt, long sleeve dress shirt, and maybe some old scrubs or some old pants, and swim and get out. They dry quick, and because I don't like that greasy, especially when it gets in my eyes, it burns. But you got to cover up. So big fishing hat, sleeves or sunscreen, and then you can stay out all day, but you just got to be careful.
Boy, I'll tell you, with that diet of clothing, it's just... it's going to be tough to take.
Yeah, it is. At the same time, people that struggle with that ought to come in here and follow me around for an hour while they see what happens if you don't after 50, 30, 40, 50 years. Then you can do whatever you want. It's not that you can't. You can, but there are also consequences with that. So then you have to put up with the freezing and the surgeries and the aftermath of that stuff. So it's just like smoking or skydiving or any other high-risk behavior. I mean, you can do what you want, but with sun exposure, it's going to come at a price at some point. So just be careful, have fun, but wear sunscreens, reapply every 90 minutes or so. And then when you come and see me, I'll say, yeah, come back once a year instead of once every 2 months, and it'll be a lot less painful too.
You may well have stayed out of the sun here the last few years, but that doesn't mean that you don't have something coming on you that should be looked at, and that's why I recommend, as would the doctor, I'm sure, every year you need a checkup because the little skin cancers do show up, and I've been pretty good here the last few years on it, but I'm still getting things that from 7, 8, 9 years ago from my being in the sun. And as a matter of fact, I have a bottle of nitrogen that has my name on it over at the clinic in Laughlin.
Yeah, we're almost going to put his name on a tile over there just to kind of show the amount that he's donated. But yeah. Just be careful. I think that's the best advice I can give is be careful. If you're too cavalier about the sun, it's going to come back and bite you. So I'll tell you, we cut skin cancers off of 9-year-olds, 20-year-olds, 30-year-olds. It doesn't just happen to the elderly or to the people who've been exposed for years and years and years. It's more common then.
Right.
But, I just took an atypical nevus, something that was on its way to melanoma off a 26-year-old this morning.
Oh my gosh, really?
Yeah, so get in once a year, I agree, get your skin checked. If you look gorgeous, we might say come back in 5 years. But if there are some spots to be concerned with, let's watch you. We'll watch the spots too.
Especially if you're light complexion or whatever. And sunburn, from what I understand, is what you absolutely do not want.
That's true. So that sunburn causes changes in your skin from the radiation, and that's where your cells try to repair. And anytime you ask your body to do more than it normally would, the cells turn over really fast, and your chances of developing a cancer are even better. So the people that are intermittently burned are more likely to get cancers from sun than the people who are out regularly. So if you're out occasionally and each time you're out you get burned, you really ought to come in. And anyway, I don't know if that makes sense.
No, it does.
The people that are out more often are actually at a little bit less of a risk.
And let me be quite frank with you, the times that I have, and it's usually annually because of the damage I've done to my skin, have it frozen, these little cancers that like to start up on me, it's not painful. You don't have to worry about having an anesthetic or something like that. It's just very quick. And it forms a little bit of a blister. Within days, it's completely gone. You don't even know it was there.
True.
So, don't be afraid, it's going to hurt, because generally speaking, it does. What hurts is if you let it go too long and it does turn into something larger, they've got to cut it out. And or you wind up with a big hole because it is cancer and you didn't pay attention.
That's right. That's right.
Those aren't fun.
No, those are not fun.
Not fun at all. Doctor, I want to thank you. It's always good seeing
anytime.
you.
Nice to see you too.
We'll have to come back more often and chat with you.
Yeah, enjoy your trip, and as soon as you get back, let's take a look at you.
Gonna have to. Yeah, I'm sure.
Nice
We'll be
to see
back
you.
with more of the morning show right after this. Stay with us.
Thanks.